Hi, I'm Kurt Deering. I'm a clinical pharmacist. I've been a clinical pharmacist for a little over 30 years. You run specialty clinics, diabetes, anticoagulation, and a lot of my clinics that I've ran over the years related back to cardiovascular. And today we want to talk about some supplements that are heart healthy. And there's so many we could go into. We could go into French grapeseed extract and aged garlic. However, we're going to go into today the power of omega-3s and CoQ10. So these powerful nutrients have been shown promising results in supporting heart function, reducing inflammation, and lowering the risk of cardiovascular disease. I personally think that even though it's not talked a lot about in the studies, that it's the reducing the inflammation that has the most powerful effect in pretty much all disease states, because if you think about it, disease states are either an oxidation problem or an inflammation problem, and both of these products are excellent at lowering inflammation and at lowering oxidation. So we're going to talk about omega-3 fatty acids first, and then we'll talk about CoQ10. The two of them together have been shown to have some additive or synergistic effects together, but we're going to talk about them separately for right now. Omega-3 fatty acids are essential fatty acids, and they call them PUFAs, polyunsaturated fatty acids. And they are not produced in the body, so we have to get them externally, either through our diet or through supplements. And that's our two different sources, usually fatty fish or a fish oil supplement. And then when you're looking at what's beneficial about them, usually we're talking about EPA or DHA. And what are the benefits? Well, as I mentioned first, not mentioned here, is that they are anti-inflammatory. And they do lower triglyceride levels, and interestingly enough, that's how some of the pharmaceutical companies got, at least the original, Lovesa, was approved to lower triglycerides. And is triglyceride a risk factor? It has been shown to be an okay risk factor for cardiovascular disease, but really, in my opinion, the more metabolically diseased you are, the more oxidatively stressed, the more inflammation you got going on, the more your triglycerides, you're going to be hyperinsulinemic, and then you're going to also be inflammatory. And so all this is leading up to an oxidative state of stress, and that is what's actually putting you at risk for disease. And triglycerides are kind of an indicator. It's not necessarily a cause, it's more or less a correlation. And that's kind of the way I feel about cholesterol too. It's usually a correlation of heart disease and not a causation. Usually it's the disease, it's the inflammation that's going on that's causing the disease itself. But back to omega-3s, they do reduce the risk of arrhythmias, they slow the plaque buildup in the arteries, and they do slightly lower blood pressure. So when we're looking at studies, what we want to do, and at least coming from the medical world, we're always looking at outcomes studies. We want to look to see what works, not just what lowers numbers, but what actually has the data to back it up. And we haven't always had a lot of big-time studies with it, but the studies that we do have all shown benefits, unless the study was done poorly or they used poor omega-3s. Maybe they used synthetic forms, things like that. But the ones that we can gather, and the ones I've looked at that were done properly, have always shown good cardiovascular outcomes. They reduce cardiovascular mortality, decrease the risk of non-fatal myocardial infarction, lower the incidence of coronary heart disease events, and reduce the need for revascularization procedures. So what is it about the omega-3s? It's the EPA and DHA. So one pharmaceutical company that came out with a drug, Vasepa, was trying to say that it was EPA alone that showed the primary benefits. And indeed, the data did show that monotherapy with EPA had greater cardiovascular risk reduction. In my opinion, the thing about EPA and DHA is that the molecules that come out of those have SPM, special resolving modulators. These are the things that actually come in and clean up the inflammation that's going on that's not being turned off by our body. And so these come in, send in the macrophages, clean up the area, and resolve the problem. So we see that it's a different level. It's the fatty acids, the omega-3s, it's the DHA, EPA, and then it's these SPMs that are coming in. So that's another area that's being focused in on is SPMs. That's our next phase that we're going to, and we'll do a talk on that at some future point. But who benefits from omega-3s? Well, pretty much, in my opinion, it's part of Nutrition World's Core 4 for a reason, because everybody should be on omega-3s. It's going to benefit everybody. When it comes to patients that are having heart issues, though, the ones that are going to benefit the most are the ones that have cardiovascular disease in some form. And people with high triglycerides, of course, are going to benefit from these. And like I said, I believe that it's a correlation, not a causation with triglycerides. However, if triglycerides get too high, which some genetic reasons people get triglyceride levels too high, they will be at risk for pancreatitis. And some of these will pull those triglyceride levels down and keep you from getting pancreatitis. So that would be good there too. But overall, just good because of the anti-inflammatory properties that they have here is what we're getting our cardiovascular benefits from. If you don't have cardiovascular risk factors, then omega-3s aren't necessarily ideal for you, but let's don't forget about the other benefits that we're not even mentioning here, which are the benefits to the brain and the benefits to the joints, the anti-inflammatory effects there. I mean, most of our brain is made up of omega-3s and cholesterol, so these are things that we do need. What are our dietary sources versus the supplements? We can get it through fatty fish, salmon, or cod, or excellent natural sources. Supplements should be quality. This is one area that you make no exceptions with. If you're not getting a quality omega-3, you could be doing yourself a disservice. In other words, it's not only that you're not getting the benefit of it, if it's oxidized and maybe gone rancid, then you're actually talking about something that could be oxidizing inside your body, which would be detrimental. And so this is one case you don't want to be going to a big warehouse store place and buying your omega-3s. You want to get quality as you can get. If you have a reason medically to get your provider to write you a prescription, and you can get it at a nice, like say a first tier insurance rate, by all means get the prescription ones, because we do know they're going to be pharmaceutical grade. And one of those is Vasepa that I mentioned earlier. And what I can tell you about Vasepa is that there was a study done, it was called the Reduce It trial, and it showed a 20% reduction in death due to heart-related causes, 31% reduction in heart attack, and a 28% reduction in stroke. Then there was Lovesa, that was the one that came out many years ago. It's a combination of EPA and DHA, and once again, it's indicated for lowering triglycerides, but we know that it's probably other benefits you're getting from it that's doing you the most good. If you can get these with a prescription, and like I said, it's affordable with your copay, by all means, I would get it. If it's prohibitive in the copay amount, then I would recommend getting it Nutrition World. And we've got top quality omega-3s, and that's what you're looking for, is top quality, because otherwise you may be doing yourself a disservice. The goal is to elevate omega levels to about 8%. So I'm going to talk in a minute about some studies that were done that show the value of checking your omega levels. If you are at a low 3, 2, 3, 4% or something like that, it is a better predictor of cardiovascular disease and better predictor of all-cause mortality than cholesterol ever thought about being. All right, so what is our current research and recommendations? Once again, as I mentioned before, conflicting results in studies depends on the type of the study that was done, depends on the quality of the omega-3s that were used in the study, what kind of study was it done. If you're looking at depending on people to tell you in a questionnaire how much omega-3s are taken in through their diet, then it tends not to be as reliable. If you're checking actually omega levels from the blood, then that becomes a more reliable study. So, individualized approach recommended. It's risk versus benefit. by all means, there's no doubt there's a reason why it's a part of our core four. The benefits of omega-3s outweigh any risk if you're using a quality omega-3. And of course, you can always consult a healthcare provider, one of our health coaches, for personal advice on where to go with these and how much to get. Because there are certain times that EPA may be better. It may be times when DHA in pregnancy may be a better amount to go with. So, as I mentioned before, studies show that omega-3 levels are better predictors of death risk than serum cholesterol. So, this was a study that was done. There's the title of the study right there. Results showed that the risk for death from any cause was reduced by about 33% compared to comparing the lowest omega-3 index participants to the highest. So, the lower your index was, the lower your numbers were, the more at risk you were for all death from any cause, really. And this was in the journal Lipidology, and this Bill Harris that did this study, I saw an interview with him where he kind of says they focus in on the omega-3s. He said they went back though and they looked, how did that omega-3 levels correlate with inflammatory markers like high sensitivity CRP and all the other inflammatory markers that we have in blood tests that we can do. It correlated perfectly. The higher the omega-3s, the lower the inflammation predictors, the inflammatory markers were. And the higher the omega-3 index was, the lower the index, the higher the inflammatory markers were. So, studies suggest that higher blood levels of marine-derived omega-3 fatty acids, the EPA, DPA, DHA, associated with reduced risk. So this was a meta-analysis that was done with looking at 17 different studies, pulled the data together, and once again showing that the higher levels of the omega-3s correlated with the better outcomes. A 15 to 18% lower risk of all-cause mortality. The inverse relationship was observed for death for cardiovascular disease, cancer, and other causes. The omega-3 specifically associated with lower mortality risk were EPA, DPA, and DHA. And there was no significant associations found with mortality and blood levels of alpha-linoleic acid. So, data once again showing that the importance of your omega-3 levels and how these levels are indicators of your risk factors for morbidity and mortality. So, in conclusion with our omega-3s is that they play an important role in health. The benefit outweigh the risk, and in my opinion, in virtually all populations. Studies show that omega levels are better predictors of cardio risk factors and all-cause mortality. So, moving on to our CoQ10, these offer multiple benefits in the body, but focusing in on heart, improves heart failure symptoms and outcomes, reduces cardiovascular mortality by 43% in heart failure patients. Decreases all-cause mortality by 42%, just said that. Lowers the incidence of hospital stays due to worsening heart failure. And in the New York Heart Association classes, after 2 years of supplementing with CoQ10, you can actually lower. So it could take you from a heart class 2 back to class 1 or 3 to 2 after 2 years of using CoQ10. How does it work? It enhances cardiac function, increases cardiac output by improving the heart's contractile force. It enhances oxygen utilization at the cellular level, reduces post-infarction hypertrophy of the left ventricle, and improves stroke volume, stroke work, and ejection fraction. So you get a better ejection fraction using CoQ10. And then once again, we get back to what is sort of the underlying or if you look at the nutraceutical world and you look at every plant out there, every herb out there, everything we use has antioxidant and anti-inflammatory effects. That's why so many of them are good for so many disease states, is because they're all providing antioxidants, antioxidation, and anti-inflammatory properties. So you're decreasing oxidative stress in the cardiovascular system, reducing the production of pro-inflammatory cytokines and adhesion molecules, and preventing the accumulation of oxidized LDL in the arteries. Supports cardiovascular health, so lowers the risk of repeat heart attacks in patients with recent myocardial infarction. Has beneficial effects on blood pressure, up to a 17 millimeter of mercury drop and a diastolic of up to 10 points. Improves arterial endothelial function in patients with or without cardiovascular disease. And enhances energy production. It plays a crucial role in the mitochondrial energy metabolism, so it supports ATP production, which is essential for heart functioning. Okay, so to wrap it up, I'd just like to mention the fact that there's a lot of people out there on statin drugs, and if you're on a statin drug, it is going to deplete your CoQ10, and that could be problematic. So it's essential for you to be on a CoQ10 supplement if you're going to be on a statin. And if you're looking to see whether any of these supplements are a good choice for you, or you'd like to see if the medications you're on are the best choice for you, and do we have something in the nutraceutical world that may be of more benefit, maybe a little safer, then by all means at Nutrition World you can do a consult with me, Kurt Deering. And wrapping this up, I'd just like to say these were two awesome supplements. CoQ10 definitely should be on everybody's supplement list, as well as an essential one is Omega-3s. And thank you for tuning in, and appreciate it.